Greetings and welcome to this informative video on the symptoms of gout and how to diagnose it. Gout is a common type of arthritis that affects millions of people worldwide. It is caused by a buildup of uric acid crystals in the joints, which can lead to sudden and intense pain, swelling, and tenderness in the affected joints. In this video, we will discuss the various symptoms of gout, risk factors, diagnosis, and treatment options available. It is essential to understand the signs and symptoms of gout to manage it effectively and prevent complications. By the end of this video, you will have a better understanding of gout, its symptoms, and how to manage it. So, let's get started and learn more about gout. 1. Gout is a form of arthritis that occurs when there is an excess of uric acid in the bloodstream. The excess uric acid can form crystals that accumulate in the joints, leading to inflammation, swelling, and pain. Gout typically affects the big toe joint, but it can also occur in other joints such as the ankles, knees, elbows, wrists, and fingers. If left untreated, gout can cause permanent joint damage, so it's important to seek medical attention if you experience symptoms of gout. 2. While gout typically affects the base of the big toe joint, it can also occur in other joints in the body. Gout can affect any joint in the body, and it often affects more than one joint at a time. The ankle, knee, elbow, wrist, and finger joints are also commonly affected by gout. The symptoms of gout can vary depending on the joint affected, but they usually involve intense pain, swelling, and tenderness. If you experience symptoms of gout, it's important to seek medical attention to receive an accurate diagnosis and appropriate treatment. 3. Gout attacks can occur suddenly, often during the night or early morning, and can last for several days to a few weeks. During a gout attack, the affected joint becomes swollen, red, and tender, and it can be challenging to move or put weight on the joint. Some people with gout may experience frequent attacks, while others may experience chronic pain in the affected joints. The frequency and severity of gout attacks can vary depending on several factors, such as the level of uric acid in the blood, diet, alcohol consumption, and other medical conditions. It's important to seek medical attention if you experience symptoms of gout to manage the condition effectively and prevent complications. 4. Other symptoms of gout can include redness, warmth, and stiffness in the affected joints, as well as fever and chills. In addition to sudden and intense pain, swelling, and tenderness in the affected joints, other symptoms of gout can include redness, warmth, and stiffness in the joints. These symptoms can make it difficult to move the affected joints and can significantly impact a person's daily activities. In some cases, people with gout may also experience fever and chills, which can be a sign of an infection or inflammation. If you experience any of these symptoms, it's important to seek medical attention to receive an accurate diagnosis and appropriate treatment. 5. To diagnose gout, your doctor may perform a physical exam and ask about your medical history and symptoms. During the physical exam, your doctor will look for signs of inflammation and swelling in the affected joints. They may also ask you about your lifestyle habits, such as your diet and alcohol consumption, as these factors can contribute to the development of gout. Your doctor may also order tests to measure the levels of uric acid in your blood or fluid from the affected joints. High levels of uric acid in the blood can be a sign of gout, although not everyone with high levels of uric acid will develop gout. If there is fluid in the affected joints, your doctor may use a needle to remove the fluid and test it for the presence of uric acid crystals. In some cases, imaging tests such as X-rays, ultrasound, or CT scans may be ordered to evaluate the extent of joint damage and to rule out other conditions that may cause similar symptoms. Once a diagnosis of gout is confirmed, your doctor can develop a treatment plan to manage your symptoms and prevent future gout attacks. 6. In addition to measuring uric acid levels in the blood or fluid from the affected joints, a doctor may also order imaging tests such as X-rays, ultrasound, or MRI to diagnose gout or rule out other conditions that can cause similar symptoms. X-rays can be used to detect the presence of uric acid crystals in the affected joints or to look for joint damage caused by gout over time. Ultrasound can help to identify the presence of uric acid crystals in the joints and assess the extent of inflammation and damage. MRI can also provide detailed images of the joints and surrounding tissues to help diagnose gout and evaluate the extent of joint damage. These imaging tests can be helpful in diagnosing gout, particularly if the symptoms are unclear or other conditions are suspected. Once a diagnosis of gout is confirmed, your doctor can develop a treatment plan to manage your symptoms and prevent future gout attacks. 7. Risk factors for gout include obesity, a diet high in purines, found in foods such as red meat, seafood, and alcohol, certain medical conditions such as diabetes and kidney disease, and certain medications such as diuretics and aspirin. Several factors can increase your risk of developing gout, including obesity. Being overweight or obese can increase your risk of developing gout, as it can lead to higher levels of uric acid in the blood. Diet high in purines. Foods that are high in purines, such as red meat, seafood, and alcohol, can increase uric acid levels in the blood and increase the risk of gout. Medical conditions. Certain medical conditions, such as diabetes and kidney disease, can increase your risk of developing gout. Medications. Some medications, such as diuretics and aspirin, can increase the levels of uric acid in the blood and increase the risk of gout. Other factors that may increase your risk of gout include genetics, age, and gender. Men are more likely to develop gout than women. Understanding your risk factors for gout can help you make lifestyle changes and manage the condition effectively. 8. Treatment for gout typically involves managing the pain and inflammation with medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, colchicine, or corticosteroids. Your doctor may also recommend lifestyle changes such as losing weight, eating a healthy diet, and avoiding triggers that can cause gout attacks. Treatment for gout typically involves managing the pain and inflammation associated with gout attacks. Some common treatments for gout include medications, nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, naproxen, or indomethacin can help reduce pain and inflammation during gout attacks. Colchicine can also be used to treat gout attacks, although it can cause side effects such as nausea and diarrhea. Corticosteroids such as prednisone can be used to reduce inflammation and pain in the affected joints. Lifestyle changes. Losing weight, eating a healthy diet that is low in purines, and avoiding triggers such as alcohol and certain medications can help manage gout. Drinking plenty of water and other fluids can also help flush out uric acid from the body. Preventive medications. Medications such as allopurinol or febuxostat can help lower uric acid levels in the blood and prevent future gout attacks. These medications are usually recommended for people who have had multiple gout attacks or have high levels of uric acid in the blood. In addition to these treatments, it's important to work with your doctor to manage any underlying medical conditions that may be contributing to your risk of gout, such as diabetes or kidney disease. By working together, you and your doctor can develop a comprehensive treatment plan that helps manage your symptoms and prevent future gout attacks. 9. In some cases, your doctor may also prescribe medications to lower the levels of uric acid in your blood to prevent future gout attacks. These medications may include allopurinol, febuxostat, or probenecid. In addition to treating gout attacks, medications can also be used to prevent future attacks by lowering the levels of uric acid in the blood. Some common medications used for this purpose include allopurinol. This medication is used to reduce the production of uric acid in the body. It's typically taken once a day and may take several weeks or months to become fully effective. Febuxostat. This medication works by blocking the production of uric acid in the body. It's typically taken once a day and may take several weeks or months to become fully effective. Probenecid. This medication helps the kidneys remove uric acid from the body. It's typically taken twice a day and may take several weeks or months to become fully effective. Your doctor will determine which medication is best for you based on your medical history, overall health, and other factors. It's important to take these medications as prescribed and to work closely with your doctor to monitor your uric acid levels and manage any side effects. 10. If you're experiencing symptoms of gout, such as sudden and intense pain, swelling, and tenderness in your joints, it's important to talk to your doctor for an accurate diagnosis and appropriate treatment. Early diagnosis and management can help prevent complications and improve your quality of life. It's also important to work with your doctor to develop a comprehensive treatment plan that includes both short-term and long-term strategies for managing your symptoms and preventing future gout attacks. This may involve a combination of medications, lifestyle changes, and other treatments, depending on your individual needs and circumstances. Remember, gout is a manageable condition, and with the right treatment and support, you can reduce your symptoms, improve your overall health, and enjoy a better quality of life. So don't hesitate to talk to your doctor if you're experiencing symptoms of gout or have a history of the condition. In conclusion, gout is a painful condition that can have a significant impact on a person's quality of life. It's essential to recognize the symptoms of gout and seek medical attention promptly to manage the condition effectively. By making lifestyle changes, taking medications as prescribed, and avoiding triggers that can cause gout attacks, you can reduce the frequency and severity of symptoms. We hope this video has been informative and helpful in understanding the symptoms of gout and how to diagnose it. If you have any concerns or questions, please speak to your doctor. Thank you for watching, and we hope to see you in our next video.